Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hyperamylasemia, and we are looking at its causes. So hyperamylasemia, it can occur due to the pancreas. That is in terms of the pancreatic diseases. So in pancreatic diseases, it can be due to the acute pancreatitis and the pancreatitic pseudocyst. Next is the presence of the ascites caused by the pancreatic duct. So there can be ascites, and this is due to the pancreatic duct. Pancreatic duct is disturbed. Next is the pancreatic necrosis. The pancreatic necrosis as well as the presence of trauma or the carcinoma. Next, we move on to the non-pancreatic disorders. So under non-pancreatic disorders, it can be due to the renal insufficiency. It can be due to the salivary gland lesions. And under salivary gland lesions, this can be due to the mumps. It can be due to the presence of calculus, the irradiation, sialodentis, and also the maxillofacial surgery. Then it can include the carcinoma, and this is of the lung, esophagus, the breast or the ovary. Then looking at there is also the macroamylasemia. Then the presence of burns, the DKA. DKA stands for the diabetic ketoacidosis, the pregnancy, the renal transplantation, the cerebral trauma, and also the drugs such as the opiates. So drugs such as the opiates. Then we move on to the abdominal disorders. So what are present in terms of the abdominal disorders? So under abdominal disorders, it includes the biliary tract diseases. So there is BT diseases, biliary tract diseases. So under biliary tract diseases, there is a cholecystitis as well as a choledocholithiasis. The choledocholithiasis. Next is the intra-abdominal diseases. So under the intra-abdominal diseases, there is presence of the perforating or the penetrating ulcer. So there is perforating or the penetrating ulcers. Next is the intestinal obstruction or the inflammation. Intestinal obstruction or the inflammation. Then comes the involvement of the ruptured ectopic pregnancy. There is ruptured ectopic pregnancy. Then there is the peritonitis and the aortic aneurysm. Then comes the post-operative. To learn and grow daily like this, please do subscribe.